Hello, folks. Thank you so much for being here today. My name is Jackie Moore. I am a clinical social worker and one of the therapists here at Canopy EAP, which, of course, is all of your EAP organization. Happy Mental Health Awareness Month. May is Mental Health Awareness Month if you were unfamiliar. So, of course, always every month really is Mental Health Month, but in particular in May, we like to take some time to focus a little bit specifically on what that looks like and what that means. So, thank you all so much for being here today and taking a little bit of time to talk a little bit about mental health. Um, just as a couple of quick sort of housekeeping things to go through with everybody first. So, for starters, I'm actually going to hopefully pull this up. This might not look identical depending on if you have the updated version of GoToWebinar. If you have the updated version, it might not quite look just like this, but the drop downs are going to be similar in nature and similar in name. But there are a couple of things I did want to point out to folks about the GoToWebinar platform that we are using. So, unfortunately, with this platform, I'm not actually able to hear or see you directly. But that being said, of course, I absolutely would love to hear any questions, comments, thoughts that might come up throughout the course of the training. So, folks might notice that there's sort of these side panels, drop downs, whatever you want to call them, that have a couple of different names. Um, the first one I want to point out is going to be the one that's labeled questions. If you can go ahead and open up that questions box, you can feel free to put in there any type of questions, comments, thoughts that might come up throughout the course of the training. I am able to see that and I can speak to it pretty immediately, so definitely feel free to utilize that. I'm also going to ask some questions throughout, so if you felt comfortable answering those questions, I would definitely love to hear people's thoughts and hear people's perspectives on that. Additionally, you'll notice that there is another drop down box, whatever it might be, that's labeled materials. If you click on that materials box, there should actually be two things in there. So the first is going to be a copy of the slides that I'm using today. If you'd like to grab these slides and take them for later or use them to follow along, you can definitely feel free to do that. Those are available to you. Additionally, in there is going to be a GoToWebinar tech help. I very much appreciate that we are kind of at the mercy of our technology, which is both a blessing and a curse. But that being said, technology is obviously a little finicky. On my end, I'm not super helpful. I'll be honest, I'm not super helpful with the tech piece. There's not a lot I can do on my end. That being said, I will say my go-to is have you tried turning it off and turning it back on? That can sometimes be helpful. If those aren't working, I would say definitely to take a quick peek at the GoToWebinar Tech Help. That can potentially provide you with some suggestions of common issues that come up with GoToWebinar and maybe how to address those. Alrighty. Now, before I do dive in, I kind of do want to double check here, and it looks I've already got some questions, so that's awesome, or I have some comments. I did want to ask if folks were okay with this. If you're willing, can I just have you send into that questions box really quick, like I can hear you, I can see you. I kind of just want to check my tech really fast. I want to make sure that I am being heard and seen. Will a resource list be emailed out to us after the webinar? A resource list is not going to necessarily be emailed out. I would say to grab a copy of the slides because the slides are going to have those resources in there. So definitely want to take those. I am getting a whole bunch of thumbs up. So that is super awesome. Looks like we are definitely being heard and seen, which I like to hear. Don't want to talk at myself for an hour. So that will be wonderful. The recording will be available afterwards. So that is a heads up that I am recording. So this should be available to folks afterwards if you wanted to send it to other people or rewatch it or whatever it might be. But it looks like we're doing okay. I think we're okay tech-wise. So I'm actually going to kind of start off with just asking a little question here. And again, at your comfort level, you can feel free to respond if you'd like in that questions box. But we are, of course, talking today about mental health awareness. Moved my slide ahead too fast. Nobody saw that. Nobody saw that slide. Right. So we are talking about mental health awareness today. We're going to talk about a few different things. We're going to talk about what mental health is, some statistics about what this looks like in the US, some signs and symptoms, and then I'm going to talk a little bit about emotional health and self-care, sort of general maintenance ways that we can be helping ourselves in managing mental health, as we will talk a little bit about risk factors as well. So knowing that, and knowing, of course, that I am speaking about mental health pretty specifically from a United States perspective, my question to all of you is, if you had to take a guess, what do you think is the most common mental health disorder in the United States? The one that, is most commonly diagnosed or most commonly experienced. We got depression, anxiety, depression, anxiety, depression, anxiety. Substance use. We got a new one, depression, anxiety, substance use. It looks like we're feeling real strong about depression and anxiety. And I'm going to tell myself it's because people didn't see the slide that I just showed. PTSD, depression, anxiety. Ooh, we're getting them. Loneliness. Hey, I appreciate that. Not technically a diagnosis, but certainly is going to contribute to mental health issues. All right, ADHD, another one. That one I think we've seen a lot more recently. Panic attacks, sleep disorders. Okay. Wow, folks, thank you so much. And shocking to no one, I'm sure, but you all did nail it. In the United States, the top three most common mental health disorders are going to be substance use disorders, anxiety, and depression. Sometimes folks forget that substance use piece, but that actually is going to qualify as a mental health disorder. I wanted to talk a little bit about what mental health looks like in the United States. And let's overview really quickly a kind of what does this look like. So 1 in 5 Americans have a diagnosed mental illness. That is 50 million Americans annually. This is about 20% of our population. Now, what I'd like to point out here actually is that on this call, there is about 180 people on this call right now. 20% of that is almost 40 people. That means that on this call alone, there are almost 40 people who could potentially be having a mental health disorder. And additionally, I'd like to point out is that this is diagnosed. This does not include all of the folks who never receive treatment, who never receive a diagnosis, and ultimately just operate day to day with their mental health issues without actually receiving that additional support. So that 1 in 5 is actually a pretty conservative estimation. Now, the United States has sat at 20% for decades, essentially for as long as we have been researching mental health and really kind of keeping track of those statistics. We've sat at 20%. Now, I kind of wanted to speak to somebody made the comment of loneliness being a common mental health disorder. And I actually kind of wanted to speak to this, which is that there was a period of time where this 20% actually pretty radically changed. And I'm sure everyone could guess this. That period of time was during the COVID-19 pandemic. We saw a pretty substantial change to the percentage of folks with mental health issues. So I'm going to ask another question here if you wanted to take a guess. If we previously sat at 20%, and that is kind of our norm, our standard here in the US, what do you think the percentage of folks with mental health disorders was during the pandemic? Because I will tell you it changed. So it's not 20%, 50%, 85%, 50%, 40, 30, 60, 40, 50, 48, 35, 40, 67, 35, 80. I normally get somebody who says 100%. Every single one of us, all of us, we were all struggling, right? So I'm seeing a pretty wide range. I'm seeing all the way up to 85, 90%, right? Getting up to 90% to sort of that low, maybe a little lower level, 35%. So it looks like everybody is assuming that those numbers went up. They did not go down. And you would be correct. The CDC estimates that this percentage went from about 20% to almost 46, 47% of the population. So almost half of all Americans were at that point meeting the criteria for a mental health disorder. And the reason why I mentioned that loneliness piece is that we argue and believe that a large portion of this increase is directly due to the social isolation that we were all experiencing during that period of time. And I will circle back on this in just a little bit, but that social connection is going to be a really fundamental part of what we're going to be talking about today. Now, within that 1 in 5, 1 in 25 of those Americans live with a very severe and persistent mental illness. This essentially means that those folks were unable to live their daily lives, go to work, complete daily functioning tasks for more than 180 days out of the year. right? Now that people are out again and more, did the 46% go down any? That's a great question, and I totally should have spoke to that. Yes, their numbers have returned. So we are back down to our pretty typical 20% in that ballpark. We saw that number start to go, back down around 2022. So we have returned to somewhat degree of normalcy at this point. And I also want to point out here that those increases we saw were in very specific disorders. So we saw increases in the 3 disorders I have listed on the slide. So in substance use disorders, anxiety disorders, and depressive disorders. And we also saw an increase in suicidality. So we were not seeing increases in things like bipolar disorder or schizophrenia or personality disorders. Those numbers are all staying pretty much the same. What we really saw an increase on was anxiety and depression and substance use. Right? Now, to break that down just a little bit further, throw a few more stats at you. Around half of those who do have a mental health diagnosis will begin experiencing those symptoms by the age of 14 years old. And almost 3/4 of those will begin experiencing symptoms by the age of 24. I highlight this to really just show folks that for many folks who have a mental health disorder, the onset of this is actually pretty early on. And there's a lot of factors that can contribute to this, right? But ultimately, what's important to note here is early intervention, right? The earlier we are able to recognize that somebody is having symptomology or experiencing mental health distress, the earlier we can intervene. Ultimately, as you could probably guess, the better the outcomes. Right. Now, I do have some questions here. So maybe there's a lot of data on this, but did any mental health diagnoses drop in frequency during the pandemic? The only one that I would probably guess would be social anxiety, because we really didn't have to socialize quite as much. In terms of drops, I don't have any particular information that shows that we dropped in any capacity, but certainly it might be possible, right? We obviously really changed the way that we interacted and functioned over that period of time. I'm surprised it went back to 20%, since there are some people who haven't fully went back to socializing. Sure, right? Of course, right? There's definitely some folks who are still not who are not in a full recovery space, maybe returning back to our baseline normalcy, right? But for the most part, we have seen that statistic sort of drop back down. So ultimately, 20% is going to be pretty standard for the US, right? Now, 55% of adults living with a mental illness do not receive any treatment at all. So if we look at that previous statistic of almost 50 million Americans, right, that means about 25 million of those folks are not receiving any treatment. And this has to do with a lot of factors, ranging from privatized healthcare to just access to treatment, right? If you've ever tried to find a mental health professional, then you probably know that it can be a challenging process at times. And especially if I live in a community that's got that's maybe smaller and there's more limited resources, that this can be really tricky. This is also due to stigma that exists around mental illness, right? That if I seek treatment, that means I'm weak, or it means, who knows, there's something wrong with me, right? We assign a lot of very critical and potentially judgmental perspectives around mental health issues, and certainly around seeking treatment. And for almost all mental health disorders, meaning this is not specific to one mental health disorder, people delay getting treatment. So I'm going to ask another question. We know people delay getting treatment. If you had to take a guess, how long do you think on average does the American wait to seek treatment from the onset of symptoms? Do we have a guess? How much time? So we're going in years. Okay, so we got 15 years, 4 years, 5 years, 2 years, 1 year, 10 years, 2 months, a year or more, 3 months, 11 months, 20 years, 5 years, 3 to 5 years, 15 years, too long, just too long, 5 years, 2 years. Awesome. Yeah, a lot of guesses. And I really, and we do have some folks who nailed it. 42 years. Yes, this is how we comment. It's going to be in that questions box. It's almost impossible to get in anywhere. Absolutely, there's a lot of barriers. 7 to 10 years. It took 27 years to get my correct diagnosis, 6 years. So what I'm going to kind of say here is that I think folks are recognizing that it takes a long time. And you all would be correct. On average, the median wait time for folks is 10 years. In the United States, we wait about 10 years. generally speaking, to seek or access services. And like I said, there is a lot of factors that contribute to this, ranging from access to care, right? If I don't have anybody to see, how am I going to get treatment, right? To the fact that just seeking out the treatment in and of itself is a huge barrier. For example, if you're suffering from depression, you're probably experiencing some pretty low levels of energy and low levels of motivation. And it's going to ask you to use a lot of energy and a lot of motivation to seek out that treatment, right? Again, there's a lot of factors that contribute to this, but I really highlight this just to really show folks as well too, the very different ways that we experience mental health disorders in the United States. Excuse me, so sorry, we got some allergies rolling around in here, right? Now, that being said, I'm talking a lot about mental health disorders. I'm kind of talking in circles around this. Let's really quick break down what is a mental health disorder, right? So what is a mental health disorder? I have up here the American Psychiatry Association's definition, and it's a little bit wordy, it's a little bit academic. So significant changes in thinking, emotion, or behavior that leads to distress or problems functioning in social work or family activities. Again, kind of wordy. I would say that to break this down simply, mental health disorders impact three primary areas. Number one, they impact your ability to work or go to school, either or. Number two, they impact your ability to do your daily functioning tasks, feed the dog, pay the bills, take a shower. And three, they impact your ability to hold and maintain interpersonal relationships, right? So those three areas are going to be the most impacted, right? Allergies are horrible this time of year. I windshield wiped pollen off of my car driving in this morning. It was alarming, right? And people sure go to the doctor for physical issues quickly compared to mental health issues. What a great point. A question that I sometimes like to ask folks, it's, I appreciate, you don't have to answer this specific question but say today after you finish up this class with me, you head outside to go get some fresh air and you fall down your front steps and you break your ankle. How many people on this call are going to say, rub some dirt in it, right? And then wait 10 years to go get their ankle looked at? I would argue that probably not a lot of people are going to wait that long. I usually do get one. I usually have one who's like, I got it, no worries, just keep moving, right? But for the most part, we're not going to wait that long. And I appreciate that note because that really highlights, again, the very big differences between the way that we view mental health versus physical health. Physical health, right, you can visually see, oh, my ankle is broken, right? The bone's sticking out. That's a problem. It's not as easy and it's not as visual to see these mental health symptoms or issues. And so it becomes a little bit more tricky sometimes for folks to push past some of that stigma. Right? Now, that being said, I do also want to just highlight, and I think a lot of folks could probably guess this stuff already, but I think it's important to just sort of highlight really quick before we move on. If people are waiting 10 years, what's the impact? Does that have a consequence that we're waiting a long time or potentially indefinitely, right? I never seek treatment. Is there impacts to this? As I'm sure you could guess, there are 100%. And I would also add, if you wanted to add anything to this list, please do. But of course, we see a decreased quality of life, right? Just generally less contentment, less happiness in our lives. Certainly, we see relationship difficulties and conflicts, right? Substance use. I think we're all familiar with the concept of self-medicating, which is certainly something that we see in mental health disorders, and some mental health disorders more than others. Problems at work or school. We know that, especially knowing that that's one of the three that's really impacted. And then on the more severe end of that scale, we absolutely do see things like legal and financial problems, which can lead to poverty or homelessness, or on that really high risk end, right? We see folks engaging in harm. Typically, that's going to be harm towards oneself, right? Generally speaking, I will say that this is another area where stigma impacts. For the most part, research is very clear. Folks who have a mental health issue are significantly more likely to harm themselves than they are to harm anybody else. There are some very specific sort of disorders that maybe there's a higher risk for harm to others, but ultimately folks with mental health disorders are much more likely to be the victims of violence than they are ever to be the perpetrators. And this is certainly an impact as well, too. And then medical problems and earlier premature death. The estimation is that untreated mental health problems can take upwards of 10 years off of your life. And this can be due to increased medical problems that are exacerbated by mental health issues, such as heart problems, right? Or GI issues, right? Other things like that, which can really contribute. Now, I do see a couple of questions, so I am going to work my way back here. A lot of people are waiting until it's at a detrimental state and can't continue that way. That is very true. A lot of folks kind of reach sort of like a rock bottom or a breaking point where it feels like I no longer can sustain the way I am, and that really kind of what pushes us. Let's see. And then what percentage of people postpone looking for help due to not wanting to get started on drugs and their side effects? I mean, that is a very fair question. A lot of folks have very strong feelings around medication and don't necessarily want to utilize medication as a form of treatment. But I will also say, too, that certainly isn't the only form of treatment. We'll actually talk a little bit about that today. I'm going to briefly run through what that would look like. I will tell you, I couldn't tell you the exact percentage on that. I would have to look that up, and I wouldn't want to give you the wrong information on that one. Let's see. And then as a teen, before I saw a mental health professional, I had some unhealthy coping mechanisms to deal with the discomfort. It's very difficult habits to break. And I think that's a great point, especially when I was kind of mentioning earlier, sort of those age ranges of when we notice symptomology. Is in those age ranges, our brain is not fully developed yet, which means we have a lot more neuroplasticity, which means that any habit we pick up is likely going to become more ingrained. So that can be helpful, and it can also be really unhelpful. And again, potentially maybe even make some of those mental health symptoms a little bit more powerful, right? And then the shame spiral and stigma when your HR manager thinks your diagnosis makes you a murderer and follows you into the bathroom at work. You're going to feel a bit bad about yourself. Oh my goodness. Certainly. I mean, what a powerful example of what that stigma can really look like. That is, I'm so sorry that you're having that experience, and certainly is not going to help anybody feel comfortable and safe being open about what their experiences are, which ultimately is one of the biggest barriers for folks being able to seek and access some treatment and support. Now, that being said, and thank you all so much for your comments, I do want to talk a little bit now about some common signs and symptoms. Now, one of the first things I'm going to say is that I do not have the time today because we only have an hour, and if you can't tell already, I kind of talk a lot, but we do not have the time for me to break down each of the different disorders as much as I would love to do that. So what I'm going to show up here on the slides are going to be some very general signs and symptoms that are not necessarily directed towards one specific disorder, but rather are just larger indicators of potential mental health distress. So kind of keep that in mind. I'm not speaking about one specific disorder when I'm talking about these signs and symptoms, okay? So a lot of these I think folks could probably guess or maybe are familiar with or could call out, but common things are going to be changes in appetite and changes in sleep. And notice that I just said changes, right? I didn't say an increase or a decrease in either direction, right? And that is because it can go either way. Changes in appetite can become overeating or undereating. Changes in sleep can become insomnia and hyposomnia. Ultimately, what we're noting here is a change from the baseline. This is going to be pretty crucial when we're thinking about mental health symptoms onset. All of us have a different standard for how we function and operate in life, right? All of us have a different baseline. Some folks are more social, some folks need more sleep, some folks need less food, right? All of us have a different baseline. What matters here is how it changes from our baseline. And so if we are experiencing something that, or noting in somebody else that they are operating differently from their norm, that is the ultimate concern, right? Because we can't necessarily largely lump, what is normal and what is not. Ultimately, all of us are going to be a little bit different in how we experience those things. Now, social isolation and withdrawal. I'm going to come back to this one, right? Kind of have a dollar for every time I talk about this. Social isolation is probably, I'm going to blanket statement right now, that is the number one indicator of mental health distress. Humans, by their nature, are social creatures. We are supposed to be around other people. It's the reason we create families. It's the reason we create communities. And I mean, you could even go back thousands and thousands of years to sort of our Neanderthal roots, right? That if you were excommunicated from your group, that was almost a guaranteed death sentence. You were not going to survive the elements, the animals, all of that on your own. You needed a community to help support you and so that you could play a role within that community. And even though we obviously are not living in times where there's saber-toothed tigers, right? But that holds the same. we are still social creatures. And again, I appreciate we all have a different baseline for this. I know there's some introverts on the call going, okay, yes, but, and that's very true, but you still have some folks, right? There's still a couple of people there where you're like, yes, I want to be around those folks. This is crucial to human well-being, and it is the number one reason why the pandemic was so powerful for folks, is because we were not only not allowed to be around people, we were being told that we actively had to stay away from other people because it was going to hurt us. And in the long run, obviously that was needed and necessary during the pandemic, but it has its impacts. We need to be around people. So if we notice somebody beginning to isolate socially, they no longer answer your calls, they're no longer responding to your text, right? We absolutely want to indicate that as something's going on. This is somebody experiencing distress. They are beginning to isolate. Hopelessness, crying, feelings of guilt or worthlessness, shame. I should have added that one in there. I don't even know why I forgot that one. Oh my gosh. Shame is a huge one. There is a lot of shame for a lot of folks who are experiencing mental health symptoms. Neglecting responsibilities, or just generally a very low level of energy or motivation to be able to engage in maybe some of those responsibilities. Difficulty relating to people or situations, right? Um, don't feel shame for forgetting to add shame. That's funny. Thank you. I appreciate that. Thanks for validating me. Difficulty relating to other people and situations, essentially feeling that sense of like separation and isolation. We're back there again, right? There's this feeling of I'm not like everybody else. I don't belong. I'm not part of this, right? And I think this ties in with that feeling of hopelessness, right? Nothing is going to get better. Nothing I do will make this change. Nothing is going to feel better. And as you can imagine, that is certainly going to perpetuate a lot more distress, right? Anger or hostility can absolutely be an indicator of distress. I'm sure folks have maybe even seen that or noticed that at times. Changes to sex drive. There's also just a term in mental health called anhedonia. Anhedonia refers to the concept of losing pleasure in things that you previously experienced pleasure in. Obviously, sex is something that I think a lot of folks think about, but there are many other things that would fall under that category, such as hobbies or other interests, right? Where you no longer feel any interest, desire, or enjoyment out of experiencing those things. So even if you went and did those things, right, you engaged in your hobby, you didn't feel the pleasure that you would typically experience when you have that, when you are doing that hobby. Decrease in general functioning across the board, feeding yourself, hygiene, right, things like that. Illogical thinking or thought processes, and maybe that even impacting speech, right? So I am having difficulty following somebody's thought process. It feels difficult to understand how they're moving from one topic or another. Oh, I do have shame in. Haha, I do have shame in. All right, I remembered it. So feelings of guilt, shame, and anxiety. I knew that because that's such a powerful one. I'm glad I didn't forget that one. And then, of course, thoughts of death or suicide is going to be a very high risk, certainly with certain disorders. For example, the depressive disorders have much higher rates of suicide or self-harm than maybe, for example, anxiety disorders. And then increased use of substances or unhealthy coping skills. Now, substances are probably the thing that we think of most that is most commonly utilized, right? So something like alcohol or tobacco or just other drugs. And it's not to say that that is not it, right? That is certainly part of it. There's high levels of comorbidity, meaning that you experience both a mental health disorder and a substance use disorder. But this can be other things too. There are a lot of unhealthy coping skills out there. The example that I always give is I had a client that during the beginning of the pandemic, over the first year, I believe it was about a year, she spent almost $8,000 on Amazon because clicking that, buy now, or I forget what the button is on Amazon, but the button you press to purchase your order, right, was creating such a powerful dopamine dump for her that she felt like she almost kind of became addicted to shopping, right, and suddenly was spending a lot more money than she had ever intended on actually really spending. Now, I'm not in any way, shape, or form calling anybody out here, right? But I'd even have you reflect on whether or not there are some coping skills in your life that maybe aren't substances, but at the same time, maybe also can sometimes bring on some challenges, right? There are certainly many coping skills out there that are not necessarily going to create the best health or outcomes, right? And we can definitely find ourselves engaging in those when we are in distress, right? Is there any data tracking the correlation of the top 3 mental health disorders and the amount of time that people spend on social media or screens in general, especially since it is only grown exponentially with regard to technology, and it wasn't super relevant 40 years ago? It's a great question. I will say that there is definitely some research that argues that screen time can really correlate to a lot of different mental health issues. Partially, this is because it kind of perpetuates some of that social isolation. Ultimately, even if you are interacting with people online, through a screen is not the same thing as interacting with somebody in person. For example, even if I was sitting in a room with all of you right now and teaching this class out loud face to face, you would get a very different experience with this training than what you're having right now, just because you only have access to this much of my face, right? You only have access to yourself, right, in terms of interacting within this training, right? And this does create some limitations in our ability to connect with other people. So when folks find themselves essentially replacing their social interactions with screen time, I'm going to say 100% that is absolutely going to be a factor that contributes to mental health issues, right? We can't limit our socialization to only occurring via screens. It's not to say that we can't have some socialization through screens. We certainly can, and we do, and it's also going to keep happening, right? But to say that that is the only way, that's going to really going to potentially cause some harm, right? I feel so distant from my coworkers now that we are mostly remote, and I really want to normalize that for folks. That is an experience that we're hearing from a lot of places, and because of this, it also requires so much more intentionality and so much more effort to make sure that you are meeting your socialization needs. If you are working remotely, for example, there's not a lot of reasons to leave your house unless you give yourself reasons to leave the house. And if you are struggling with motivation or energy, then asking yourself to get up and leave the house is going to be really challenging. And then you can again see how these things sort of feed into each other. So that was a long-winded answer to that question. But essentially what I would say is that ultimately, yes, I do believe those screen time factors really are going to be contributing pretty strongly to potential mental health disorders, depending on, obviously the amount of time that you're spending on a screen. I'll say, for example, that when I meet with folks for a first time, those are usually questions I ask, right? How much time do you spend on the screens? And I will never forget the time that I met with a 17-year-old and I asked about that. And she said, well, my screen time is usually around 7 hours a day. And I was initially like, okay, that's like a full-time job. You're on your phone. That's a full-time job right there. And she immediately responded with a slight amount of defensiveness of, well, most of my friends are like 14 hours. So mine's actually a lot better. And the reality is that we have, generationally, we also have very different relationships with screens, right? We have very different relationships with what that looks like in the use of technology. So I'm kind of going off on a tangent now, but the answer to that question is it certainly is a factor that definitely does contribute. I do want to ask, do folks feel like there's other things that you would want to throw out there? Is there other signs or symptoms that maybe you would have noticed, right? That you want to throw in there? Certainly is a non-exhaustive list. And I'm glad to show you my face. I love trading and I love doing this stuff. So I love being out in there. And if I could see all your faces, I totally would. But I know that that's a little limited. Now, I thank you very much from not seeing others. So I'm assuming it means I got all of them and I absolutely nailed it, right? Right. But I do want to talk now for just a moment about the concept of risk factors. And this is going to circle back to that social isolation piece that we're talking about. Now, in mental health, we use the concept of risk factors and protective factors, right? Protective factors are things that are going to actually help prevent a mental health disorder from developing. And then risk factors are things that would likely contribute to you developing a mental health disorder. Now, I want to just throw out there that there are lots of risk factors, there are lots of protective factors, and additionally, having a risk factor or having a protective factor does not inherently guarantee anything in either direction, right? This is more so just general sort of correlations that we do see. So risk factors. Number one, across the board, always and forever, I will say this for my last breath, trauma is a risk factor for every single mental health disorder that exists. Now, we could do a whole training just on trauma, but trauma is going to be a risk factor for every single mental health disorder. If you have had a traumatic experience, this inherently increases your risk for developing mental health symptoms. Now, what is trauma? that in and of itself, hard definition. I've always loved to ask people, can you define trauma without using the word trauma? Because it's kind of hard to not do that. And my quickest answer to this is that the definition of trauma is anything that you experience that is beyond your capacity to cope. If you can't cope with it, it's traumatic. There we go. Right. So if you can't cope with it, it's traumatic. This is going to increase that risk. Right. So trauma, oh, I'm seeing that now, the altitude sickness. Yes, there you go. So if that was a traumatic experience, that absolutely could induce that, right? And medical, I will also say medical issues in general can also certainly be traumatic, but it can also induce mental health issues. Mental health and physical health are not siloed. They are deeply, deeply intertwined, right? So trauma is always a risk factor 100% of the time, without a doubt, and trauma looks different for everybody, right? Um, Next is substance use. This does increase your risk, and for a couple of different reasons. Number one, heavy substance use unfortunately does increase your risk for a traumatic event to happen. I think folks can probably see how that might be. Additionally, substance use to an excess can also change your brain chemistry. It can kind of change the way that your brain functions and operates. And certain substances can also induce certain mental health issues. For example, I'll use the very fun one, right? Does the traumatic event need to be recent for it to be a risk factor? No, it does not need to be recent at all. I would actually argue that, so for example, like childhood traumas, those can disrupt our developmental stages, which means it's going to have potentially a lifelong impact. So it does not need to be recent. But in terms of the substance use piece, I'll give this a very joking example. And this is not me telling anybody that they cannot do this. But for example, excessive caffeine can 100% induce anxiety, right? So if I asked you all right now, do you know where your line is with caffeine? Where if you drink one more cup or have one more espresso, that suddenly you can feel every muscle in your body, right? You are seeing through walls. You are, right? You have reached that sort of pinnacle, right? Um, right. If you don't know where that line, I have no line, haha, coffee. Listen, I am not here to tell you what to do, right? But I will say is that we can induce some mental health symptoms and distress through substance use. And for example, caffeine is a very common one, right? If you have one too many cups of coffee, you can absolutely induce anxiety. And for some folks, that might even result in something like a panic attack. So I will say that even though, and this is my bias showing up because I don't drink coffee, I've never drank coffee, I don't think it tastes good. That's a very unpopular opinion, but I don't think it tastes good on my personal perspective. But that you would want to hopefully know where your limit is so that you don't find yourself in a place of accidentally maybe given myself just a little bit too much, and now I've given myself an uncomfortable situation to be in. Right. So that's just a common example. Genetic predisposition, I'm sure a lot of folks could guess that this is the case. If you have immediate family members, specifically if you have direct biological parents or siblings who have mental health disorders, this can definitely increase your likelihood. And certainly with certain disorders, there is a higher genetic or what is the word? I forget the word, but there's a greater correlation with certain disorders over others. And then some of this is also modeling as well. For example, I don't love saying this, but it is ultimately true. Anxious parents raise anxious children. Part of this is also just modeling, that if I have seen my parents engage in a certain capacity, I'm likely to also engage similarly. It's very common as well for substance use. That is one of the strongest correlation factors, is if you have a parent with a substance use disorder, your risk for developing a substance use disorder is a fair amount higher than folks who did not have that in their parent systems. Stressful life circumstances. So I'll say that maybe I think somebody said earlier, what if something was traumatic, but you could cope with it? I maybe would call that more just like a big stressful life circumstance, right? If you felt like you could cope with it, maybe we wouldn't qualify it or call it quite as much of a trauma, or maybe it'd be kind of like that little T versus big T trauma, right? But just stressful life circumstances. Maybe it wasn't something you would call traumatic, but it certainly rocked your world a little bit. Maybe you're going through a divorce, or, you have to move abruptly, or you got laid off. I don't know. Maybe we wouldn't certainly call something necessarily traumatic, but it would still be incredibly stressful. That absolutely can be a risk factor for certain mental health disorders. All right, here's another dollar. Lack of social supports and connection. If you folks could take one thing away from this training, it is that social connection is fundamental to human well-being, and without it, we really, really suffer. Right? If I could just have you take one thing, it's going to be that piece. So a risk factor is going to be a lack of social supports and a lack of connection. That is the number one risk factor. If you don't have people in your life who love you and care about you and support you and make you feel like you are part of their community and their family, your risk for mental health issues is a lot higher. Right? That isolation takes a significant toll on our well-being. Systemic injustice or discrimination, I would really love to acknowledge that on a large scale as well too. If you live in a body or exist as in a minority that experiences ongoing discrimination and disenfranchisement, this certainly is going to increase your risk of ultimately mental health disorders. And partially, as you could probably guess from this is due to the fact that it does increase your risk for trauma. Right? If you are experiencing systemic injustice, that increases your risk for trauma. Right? So this is certainly going to be a risk factor. And then lack of access to care or resources. We could guess that one, right? If you don't have support networks, we don't have resources, we don't have treatment, then the risk that mental health disorder is going to become much more severe or get exacerbated is obviously much greater. Did folks want to add anything to this list? Other things that maybe we're thinking about that we noticed? Also, I'm just seeing now that somebody else agrees with me that coffee tastes bad. So thank you. I appreciate that. I agree. And I worked at Starbucks for 5 years, which is the irony. Do you know how chronic pain plays? Oh, thank you for bringing that up. Chronic pain is absolutely a risk factor. 100%. It's actually a very not talked about risk factor. So I appreciate so much you bringing that up. That's a failure on my part that I don't have that in there. It is estimated that 70% of people who live with chronic pain or a chronic illness also meet the criteria for depression. Chronic medical, ongoing chronic things like that are absolutely risk factors. And I really appreciate you noticing that or noting that and bringing that up because that is definitely going to be huge. And you can imagine, right, if you live in a body that does not function for you the way you need, or it creates a lot of distress or pain, that's going to increase your overall distress. All right. Generational differences between parent and children regarding work and finances. Huge, but there's huge generational differences. That is a great point. And I can also say that there's just very large generational differences as well in regards to seeking care and seeking treatment. You know, younger generations are seemingly a lot more comfortable talking about mental health issues and talking about their treatment for those mental health issues. All right. So that also makes a difference because that reduces isolation. Right? Whereas folks who we kind of have that white knuckle it, you know, grin and bear it, pull yourself up by your bootstraps, that actually perpetuates more social isolation. All right. Let me see. These are invisible things that others do not see, therefore don't usually understand this. That sucks in support. Certainly, right? A lot of these things are part of our identities. They're part of our experiences, and those are not necessarily as tangible. But certainly I think about this from that factor, right, of how can we continue to shine lights on these identities, right, and shine lights on and expose, right, what this actually means and how it really contributes. And that's why it is so powerful to make sure we are creating spaces for everyone to be able to share their voices, no matter how different their experiences are from our own. All right. Now I'm running out of time, so I'm going to keep moving here. So I really quickly wanted to run through who can potentially help, right? So the types of mental health treatment that exist. I think a lot of folks could know probably a lot of these. Psychotherapy is probably going to be the most common. So that's individual, couples, family therapy. Medication is going to be the next. And research does show that the most efficacious forms of treatment are a combination of therapy and medication. Both are effective on their own. They both can be very effective, but generally speaking, the recommendation is that you do these two things together. Psychoeducation, which, surprise, you all are doing that right now. That's what this is. This is psychoeducation. There is hospital inpatient or residential care. This is the more severe end of the spectrum. Most folks will not get to the point of needing inpatient or residential care, but is certainly available for more severe and persistent mental illness. Support groups and self-help groups. The most common famous example of this would be something like AA. That is something that would be called a support group. Generally, there's peer support there, meaning folks who have lived experiences. Right. And then specialty therapy treatments, things like ECT, which is electric shock therapy, EMDR, which is a trauma treatment involving eye movement, and then TMS, DBS, and VNS, which are all nerve stimulation treatments. These are definitely specialty forms of treatment. I'm not going to lie to you all, you're going to have to fight your insurance to get access to these. Usually they require you to jump through quite a few hoops before they're willing to cover these. The joy of insurance, but they are available as potential alternative options for things that we can be doing. Shock therapy, I know that one sometimes seems a little jarring, but it's not utilized, I think, quite in the way that folks think of. That is more in regards to sort of using the electric shocks to essentially turn on parts of the brain that have kind of gone offline. So there's some very severe forms of, for example, depression. Okay, so very severe depression can actually result in parts of your brain essentially kind of going offline. So something like electric shock therapy can kind of turn that back on. So when I say that, it's not utilized quite like maybe you would think. I think there's kind of like this media version of what shock therapy looks like. That's really not what we're thinking about quite as much anymore. It's utilized in a different capacity. And for some folks, it can obviously be very, very helpful. And then who can help? Most people in the United States are entering the mental health care system through their doctor. That is where most people start. And your doctor can help. So that can be your primary care provider. That can be an emergency room doctor, or urgent care. They can all provide referral. They can all provide diagnosis. They can all provide medication management. And they certainly can help get you to access other mental health services. So certainly an option. Psychiatrists are going to be MDs, so they do med management. I will tell you that accessing a psychiatrist is sometimes hard. There's not that many of them, and a lot of people need to see them, so there is usually a wait list for psychiatrists. Psychiatric nurse practitioners are a fantastic alternative because they do almost the exact same thing as psychiatrists do, and you can usually get in with them a little bit more quickly. Psychologists are going to be PhDs, so they don't do med management, but they can do counseling, of course, and they do a lot of a psychological assessment and testing, so sort of really seeking out to access that diagnosis and hopefully get an accurate one. Clinical social workers, I'm clearly biased, but I am a clinical social worker. We are the founding counseling profession. All the other counseling professions are rooted out of social work, but certainly can help in that capacity. And then there's obviously other types of mental health professionals too, like marriage and family therapists, licensed professional counselors. All of them can provide counseling services. Certified peer support I mentioned that a little bit ago, but it's sort of that lived experience, meaning this person has had the same experience that you are having, maybe not identical, of course. But the most famous example of this, of course, would be AA's use of sponsors. Sponsors would be considered peer support. And then certified drug and alcohol counselors, those folks just have specialty education around substance use. Right. So I know there's a couple questions here. Why is it left up to the person to do research on the symptoms? I was diagnosed at 20 with depression, 30 with depression, anxiety, 38 with bipolar, and finally found a therapist who asked the right questions, and I have ADHD and autism spectrum. The answer to that question is there's a lot of factors there. There is definitely not always, like every profession, there are not always fantastic people who are in the field and who necessarily always know what they're doing or what they're looking for. I will also say is that it's not exactly an exact science. I will say that as someone who can diagnose. The presentation of symptoms can look really different in people, even if it is kind of considered the same symptom, because ultimately we all present differently and have had different perspectives and experiences, and it can be harder sometimes to see how those symptoms look in certain presentations. I'd also say that certain disorders are really under-researched, and the way they are researched are a bit biased, right? So for example, there is a lot more mental health research on the presentation of men than there is women. And that is coming from a gender binary, of course. But so there are challenges that come with diagnosing, right? Because there are many layers to that piece. And for a lot of things, there's this is where medical and mental health really divvy out, right? Medical, we can use like blood tests, we can use, EKGs, we can measure your oxygen, we can measure things like that. That doesn't exist quite the same, right, in mental health. And rather, we are trying to utilize the information we have, which is typically self-report from the client. So there's a lot of factors to this. And I will say that certain diagnoses take much longer to access process than others. I know mentioned in there, for example, bipolar disorder. On average, bipolar disorder can take years to diagnose, and that's because we need to see both a manic episode and a depressive episode, and sometimes that can take a long time. So some disorders are harder than others to diagnose. Essentially, I'm kind of going off on a spiel here, but there's a lot of factors to that, and I I acknowledge that that is a barrier, and I totally appreciate that that is the case. And obviously, asking somebody to continue to push for 30 something years to get the diagnosis that is accurate for them is one, traumatizing. Like, let's be real, that's traumatizing. And two, it does essentially ask you as the individual to push past the symptomology you're experiencing to be able to actually utilize the care that's needed. And that is not realistic either. And I do appreciate that. So there's a lot of layers to that. And the mental health field is really growing rapidly. Only in the last 10 years or so would I say that there really has been any interest or desire in putting money and time and energy into further researching. You know, for example, trauma is like the least researched field of mental health. Only in the last like couple of years have we even really started researching, right? How do you combat the old school mentality towards mental health? You talk about it. That's the easiest. That's the quickest form of stigma reduction, is you talk about it and then it consequently normalizes it. So say that is where I come from, and you normalize and you also give faces to these experiences, right? Somebody might be like, oh, I don't know anybody who's ever been depressed. And then when we can go, well, I've struggled with depression, this now creates a degree of like humanity to it, where it goes, oh, okay, there's somebody I know, I love, and I care about who's experiencing this. And it can kind of reduce some of that stigma as well. So talking about it for sure. I had to take care of customers. Is this recorded and can get the recording? Yes, it is recorded and should be sent out. So when I've shared with my anxiety with coworkers, I found others have it too. It's very common, right? A lot of us feel like we are kind of on our own and alone, and here we are again to that social connection. But when we open up that doorway and allow others in, we actually usually find that a lot of people can relate. And even if that doesn't take away the experience, it can usually help people feel a little less distressed, to just know that I'm not alone in this, right? Um, I will say that I wanted to speak to this really quick too, right? One of the powerful things about therapy is not necessarily the modalities or the interventions or the skills that are taught. Not to say that those aren't helpful, but what we do know from the research we have is that the most therapeutic part of therapy is actually the relationship that you have with the therapist. If you feel like you can trust them, if you feel like you can be safe with them, if you feel like you're heard and seen by them. There's a lot of people who don't have a single person in their life who they feel like they can be safe with in that regard and truly be, vulnerable. And just even having a space to do that for many people is very cathartic and therapeutic. So I wouldn't minimize the power of talking about it, I guess. All right. Now, with our last few minutes, I would not be a real therapist, right, if I didn't talk for a moment about self-care. So I'll talk for a moment about self-care. I know we've all heard that term probably 1,000 times. And it's a little bit been taken over by capitalism, to be honest, and self-care has suddenly become, vacations and massages. And it's not to say that those things aren't self-care. They certainly can be, but it makes self-care less accessible when we view it from that standpoint, right? It doesn't have to be about spending a lot of money. My favorite definition of self-care I have at the bottom of the screen. Self-care is anything that you do that creates a life you don't need to escape from. Right? So what do you do on a day-to-day basis that creates a life you don't want to escape from? And that can absolutely cost you a lot of money and be expensive and take a lot of time. It can also be free. And it can also be really, really, really little and very little time and energy. But what do you do that creates a life you don't want to escape from? Self-care is not selfish. It's not self-indulgent. It is necessary for our functioning. It is necessary for our general maintenance. And self-care looks different for everyone. What works for you might not work for somebody else. And I'm going to use an example really quickly. Right? I'll throw myself under the bus here. My go-to form of self-care is cleaning. All right. If I'm really stressed and overwhelmed, give me some dishes. Give me a toilet to clean. I'm gonna go fold some laundry. It looks like there are some people who agree with me, which thank you. I feel very seen by you all. And then I'm sure there's other people on this call going, oh my God, that's literally the last thing on the face of the earth that I would like to do when I am feeling stressed. And that's fair. I completely get that. I don't necessarily know fully why cleaning helps me, but it helps me. And so I'm going to use that. But I'm also not going to force other people to do that if it doesn't help them. Right. I have a client whose go-to form of self-care is skydiving. She goes twice a month. You're not going to catch me jumping out of an airplane for skydiving because that does not make me less stressed, right? But it does work for her. So again, it is a matter of finding the things that work for you. And I would actually throw out there, some people are already doing it. If you felt comfortable, I would love to know, can you throw in there one of your forms of self-care? Just one, you don't have to do a ton, but what is something that you do for self-care? And as long as it's not hurting you or somebody else, then it's self-care. Then you're doing it. Just don't want to hurt other people. All right. Got some great ones. Bike rides, gaming, journaling, Legos, walking, exercise, hula hooping. Ooh, that's fun. Quiet time, quilts, doing my nails, sitting on the porch. Look at all this. If you need some suggestions, take a look in the questions box. Okay. There's some great ones. Dancing. Look at crocheting, walks, horseback riding. You lost me on that one. I am terrified of horses, but I believe you that is self-care for you. I'm not a horse person. Okay, really quickly, types of self-care. There's internal and external, meaning things you do sort of in the moment to immediately regulate, whether that might be breathing or using some of your five senses, maybe having a stress ball, right? Talking to somebody. And then external, which is what I think we more think of, which is sort of things you do in your personal time that sort of allow you to engage with yourself, all right? Okay, so some tips to suggest, to help us sort of support this. Learn relaxation methods that work for you. Okay. Now I know it's all fun and games, that it's very frou-frou-y of me as a therapist to tell you to breathe or to meditate. I get that. We hear that stuff a lot. If it helps you, that's wonderful because it helps a lot of people. If you don't find yourself being more relaxed by certain things, don't force yourself to do it. Let's find something else. In this part, we can be kind of fun, right? We can be exploratory. We can be little adventurers, right? What works for me? Let's try stuff out, right? And if you need a good place to start, try starting with something that either you used to love and you don't do anymore, or start by identifying the things that don't work. That can actually help you narrow down a little bit, right? Take care of your physical health. This is, again, a fundamental part of our well-being. If you are depressed, but you also haven't eaten a full meal in 3 days, are drinking nothing but Red Bull, haven't showered, and absolutely have not, for example, talked to anybody in 3 days, then we're definitely not going to be feeling much better, right? Even if we weren't experiencing depression. So if we're doing some of those baseline pieces, that can really actually help keep our distress lower. One more dollar for everybody. Connect with others, especially the folks working remotely. You will really need to be intentional about connecting with other people. This will require a little more work, and I totally appreciate that. And there's many blessings to working remote, but this is one of the barriers, right? So we do need to work a little harder to make sure that those needs are being met. It's not to say we can't do it. Right? Even just little connections. Talk to your cashier. Don't use self-checkout. Go talk to a cashier. Right? Whatever it might be. Please feel free to pop off, folks. I know we're pretty much done. I'm just wrapping up here. Play. Even though we're adults, we still get to play. Okay? Go do things that make you bring you joy, that make you feel like that little kid, that connects you in that regard. Reach out for your social supports. One more dollar. Here's a fun one on that counter side. Limit contact with negative people. Right? If you don't like being around them, don't spend too much time around them unless you have to. Connect with a community or a group that feels meaningful to you. This is another place that you can access some social connection. Do a hobby that has a clear beginning, middle, and end, like cooking, for example. There's a clear beginning, middle, and end. This is actually very soothing for the brain to have very specific starts and ends. It's a great way to start. All right, lastly, because I do want to be respectful of everybody's time, thank you all for being here so much. Taking care of you is so fundamental. Prioritize your needs, not just the very, very basics ones. You are allowed to have multiple needs, okay? Self-care is proactive, not just reactive. We should not just be doing self-care when things are hard. We should be doing it other times too. Boundaries are important. It's okay if you need help. It's okay to say no to things, right? All that good stuff. And please reach out for some professional support as you need it. But we are pretty much at our time. So I do want to say thank you all so much for being here today. I really appreciate you spending some time talking a little bit about mental health. I also wish this training was longer. Somebody said that in one of the questions. I will throw up here really quickly. I do have some resources. Again, these slides are available up in the materials little section, so you can grab these slides if you'd like them, okay? And this is being recorded, so a recording will get sent out. I do also want to add in there, just up here on the slide, I have Canopy's contact information. Please feel free to reach out. If you are needing some help in locating a mental health professional, let us do some of that work for you. We are happy to take that off your plate. We're happy to give you some options to look for. So definitely please feel free to reach out if there is anything we can do to help you with that process or anything else, right? So please know that that is available to you. And I will very jokingly, lightly say that as homework to all of you who are still on, I really would encourage you all, do one thing for yourself today, okay? I want you doing one thing for yourself that creates a life you don't want to escape from. And you can use me, right? You can tell your spouse, hey, the weird lady I took a training from today told me that I had to go walk the dog for 2 hours, so I'm sorry I can't make dinner, okay? Use me. That's totally fine. I'm happy to be that person, okay? Alrighty, well, thank you all so much for being here. You have a wonderful rest of your Wednesday, and please let Canopy know if there's anything we can do to help, okay? Take care, everybody. Thanks for being here.